Now, let's get an update on the cholera outbreak. Let's talk to the Gautent Department of Health. We know that 21 people have died in Hammanskraal and 1 person in the Free State province. Now, laboratory confirmed cases of cholera at the Jubilee Hospital in Tshwane stand at 44. Currently, 74 patients admitted due to gastrointestinal infection. The Gautent Department of Health, Deputy Director of Suivellence for Communicable Diseases Control, Mzimasi Neti, speaks to us next. Good afternoon, Mzimasi. Welcome to today on eNCA. Can you tell us about your efforts at the moment to bring this disease, this outbreak under control? Are you succeeding?
Okay. Good afternoon, Mr. Dan, and good afternoon to the viewers at home. And thanks for having me. Yes, as a Department of Health, we are doing everything possible to reduce the number of deaths in the community. Since the outbreak last week Friday, our teams from the department, provincial and the district, have been doing case finding within the communities, so that we get those cases, the patients early, and refer them to the facility for early treatment. This is because we noticed that most of the cases who demised, the problem was late presentation to the healthcare facilities. Mr. Dan, cholera, as soon as you have the diarrhea, you may die within a few hours. It is important to rehydrate and get medical treatment as soon as possible. So the teams are on the ground educating the community to present to the healthcare facilities as soon as they have cholera-related symptoms or any diarrheal symptoms, and also encourage the community to improve on hand hygiene, and also in teaching them on how to prepare an oral rehydration salt, so that while they're in transit into the facilities, they are already rehydrating themselves, so that the risk of dying from cholera due to dehydration is reduced. Also, also within the hospital, the department has erected a tent to help triage all the diarrheal cases, or those who need urgent attention, so they can identify early and get treatment. Okay. And those who may be managed within that tent, then they will be managed that tent. So yes, Mr. Dan Moyan, there are efforts from the department to reduce the death related due to cholera.
The issue of Jubilee, so let me just come in there. The issue of the Jubilee Hospital support, you mentioned one thing, triage, you're helping with triage. What more are you doing for Jubilee to make sure that Jubilee actually copes very well with the pressure it's been under since the outbreak?
All right, thanks, Mr. Dan. The Jubilee Hospital actually has received extra staff from the Department of Health, that is the healthcare workers that are working in facilities surrounding the Jubilee Hospital. Some have been deployed to help the staff at Jubilee to cope with the number of patients who are coming into the hospital. Also, there's a provincial support, national support, and also the district support as well as the municipality support from the municipality, and also there's a support from the partners as well.
Okay.
I'm sure maybe.
Yes. Carry on.
Yes. Maybe if you hear yesterday, the Minister of Health, Mr. Dr. Hammanskraal, mentioned that they will be erecting a cholera treatment center within the community. That has been done this afternoon. So that center will be beefed up to staff now. Then some of the cholera-related cases will be managed in that tent, and those who need severe and urgent, who have severe illnesses and need medical attention, will be referred into the facility.
Okay, let's talk about numbers now that you might be aware of. We've been reporting, as I said in my intro, that there are 44 patients who have been hospitalized at Jubilee. I don't know if that number in the last 24 hours or so has gone up or gone down. What information as the Gauteng Health Department do you have from the Communicable Diseases Unit?
Yes, Mr. Den, the number you are reporting of the 44 cholera-related cases in Jubilee is correct. That was the number reported as of yesterday. A media release by the demand will release this afternoon to inform the public of the total number of cases as of this afternoon.
So this afternoon there'll be an update.
Definitely, that's the time.
Yeah. Now, there must be lessons here. You mentioned one of them, that people, when they start having diarrhea, they need to hydrate themselves, and that there's a tent that's been set up in the community as well, not just in the hospital, to assist people to rehydrate. That's one aspect. What are other aspects, especially when you have dirty water?
Okay, Mr. Den. Yeah. On the issue of water, yes, there is an issue of dirty water reported by the community. I think that one is under the management of the municipality. I think the municipality will better suited to comment on the issues of water.
Yeah, no, my question to you is not about water. My question to you from a health perspective. You've mentioned that you are teaching people in the community that they need to rehydrate. If they get diarrhea, they need to get help immediately. What else are you assisting them with in the midst of this outbreak? Because we're still very much in it. Because as far as I can recall, we don't know the source of the contamination. Where did it start? So what else are you helping the community to better understand so they can deal with this health situation?
Okay, sure. Thanks, Mr. Den. As I said earlier, we are doing everything possible to the teams from the Department of Health are in the community. Yes, we're attending, but they are our own teams visiting households door to door. On Sunday, others are going to churches, others are going to schools. So there are efforts for the teams to go around the community to educate them about as I said earlier, the problem is late presentation to the facilities. So they are educating to present to the health facilities as early as possible, and also to maintain a proper hygiene. Because you know, in some instances, I was in the ground myself on Saturday, Sunday, Monday, and Tuesday. So I've seen the conditions in which some of the people are living in. In some instances, you find reports from the community of sewage not collected. So we try to educate the community to try and maintain a proper hygiene as possible. Because where there's proper hygiene, the risk of cholera transmission is reduced.
Yeah, because I mean, after all, prevention is better than cure. And in this case, lives could be saved. Very briefly, Mzimasi, are you confident that the efforts you as a Department of Health are making on the ground, you were there yourself, as you said, on the ground from Saturday to Tuesday, are you confident that you're going to succeed to end this outbreak?
Yes, without Mr. Denmoyan, I am confident that as a department, with the support we are getting from national, the municipality, and the other partners, we will definitely control this cholera outbreak in Gauteng.
Okay, thank you very much for your time this afternoon. That's Mzimasi Neti. He is the Deputy Director Surveillance for Communicable Diseases Control here in the province of Gauteng.